Well, a number of very important organizations engaged in the fight against COVID-19 have made statements that we cannot ignore. Within the last 2 weeks, the Ghana Medical Association has issued at least 2 statements. 2 very revealing statements. Yesterday, I also read a statement issued by the Ghana Registered Nurses Association, a statement attributed to their public relations officer. The Concerned Teachers Association has also made a statement which is exceedingly interesting. There are a number of others, but it's important also to recognize that in the course of the last 2 weeks, government itself has been making statements on the fight against COVID-19, and that all of these statements need to be carefully examined. The Ghana Medical Association has made it clear that the decision to reopen schools is reckless and is likely to lead to exacerbating the situation, causing more death and so on, and has persistently been advising government to, as a matter of urgency, close down the schools. It has also told government in plain language that we need to start vigorous contact tracing. It has also recommended that we need to take action in order to start random mass testing and so on. The Ghana Medical Association has also expressed concern about the lack of PPEs in the hospitals. Now, this is the Ghana Medical Association. This is not the Ghana Journalists Association. This is not the Socialist Forum of Ghana. This is not the Convention People's Party. This is the Ghana Medical Association, which must necessarily be in the front line of the struggle against COVID-19, and which will be providing us with sound technical advice on how to fight COVID-19. They have spoken. Now, there is a young doctor who is one of those in charge of the management of COVID-19 at the Greater Accra Regional Hospital, the Ridge Hospital, who has also spoken and has indicated that one of the problems that they have is simply the inadequate supply of oxygen. And I'm sitting here and I'm wondering, oxygen? What does it take to produce oxygen? Mind you, we are in February 2021. Only yesterday, there was a report that man has finally landed a robotic engine on Mars. As we sit here, Nigeria is in space. You understand? And we cannot produce oxygen. I mean, what is the raw material for the production of oxygen? Just the air we breathe, which is available to everybody. The air we breathe has about 70% nitrogen, 20% oxygen, and so on. And all we do to produce oxygen is to separate nitrogen and other gases from oxygen and get 100% concentration of oxygen for use by patients. And in Ghana, we cannot do that. So all the noise we have been making about the status of Ghana in Africa and the world and so on, if we cannot produce oxygen, what the hell is happening in our country. And people are dying because we cannot give them oxygen. It's incredible. Now, this young doctor also goes on to disclose that the Rich Hospital, which is a dedicated hospital for the management of COVID-19 cases, has a total of only 32 beds. 32 beds. We're not talking of some clinic in some suburb of Accra and so on. We are talking about, in terms of hierarchy, in the Greater Accra region, the second best hospital in the Greater Accra region. It has only 32 dedicated beds for the management of COVID-19 cases. I mean, I'm completely scandalized. Yesterday, there were reports that the Konfo-Anokye Hospital has less than 10 dedicated beds for the management of COVID-19 cases. This is how serious we are in the confrontation with COVID-19. Then the doctors are telling us again that you need to have dedicated outpatients departments for the management of COVID-19 cases. There is no hospital in Ghana, the whole of Ghana, which has a dedicated OPD for the management of COVID-19 cases. And what does it take to have a dedicated OPD for the management of COVID-19 cases? What does it take? We can simply erect a tent or tents to serve as OPDs for the management of COVID-19 cases. And what does it take to erect a tent? Indeed, if you travel around the world, if you go to those so-called advanced countries, and I mean so-called advanced countries, you would find that they are beginning to use tents because they recognize that in this situation, in the midst of the pandemic, resources are scarce. Even where resources are available, we cannot be building huge concrete structures and so on to take care of these cases. So common sense, ordinary common sense dictates that we apply emergency measures. And applying emergency measures, the use of tents should come in handy. You understand? Just this morning when I was leaving the house, somebody I knew called and said his father had died. And then the father tested positive for COVID-19. He was declared recovered and came home. And after 1 week, developed some complications, was taken to the hospital yesterday and died this morning. And the question I ask myself is, how will this death be classified? Because I heard a member of the Ghana Medical Association discussing this problem of classification and saying that in many instances, doctors were advised to classify those who die from underlying conditions as a result of COVID-19 as not having died from COVID-19, but the underlying conditions. You understand? Now, if you have a situation like that, then we are understating the number of deaths from COVID-19. Deliberate policy of understating the number of deaths from COVID-19. If I am asthmatic I've been asthmatic for 10 years. I jump into a car, and I'm driving, and I crash the car. I die in an accident. I get into an accident. How would you classify that there? Would it be the result of the accident, of the underlying condition of asthma, and so on? So even how we classify deaths can lead to understating the incidence of death from COVID-19. And we're doing that. We're doing that to our own detriment. And we're doing that to our own detriment because if we do not know the exact extent of COVID-19 and so on, it will inform policy. The lack of knowledge would inform policy. The lack of knowledge would lead to wrong prescriptions in the battle against COVID-19. Right now, all manner of figures are being bandied around, okay? Now, it is important for us to ask ourselves, how do we come by these figures? Right now, if you do not display symptoms, if you are asymptomatic, the likelihood of you getting a test are next to zero. The likelihood of you getting a test are next to zero. The science of COVID-19 teaches us that the vast majority of those who are infected are asymptomatic. So if you have a situation where only those with symptoms are being tested, it is clear that when you're told that 5 people have it, you probably have to multiply 5 by 10 in order to get a fair idea of where we are. Indeed, there's a friend of mine who says that don't multiply by 10, multiply by 100. Now, we are listening to the doctors, we are listening to the nurses, we are listening to the midwives and so on. And they are telling us that they, the frontline workers, do not have adequate supply of PPEs. The Ghana Registered Nurses and Midwives Association is clear. It says they do not have adequate supply of PPEs. Now, this has serious implications. If the frontline workers are not protected from the virus, how can they take care of us? It becomes dangerous for us even to go into the hospitals, because the hospitals themselves can become breeding grounds. So, because the frontline workers do not have protection. What is it that these frontline workers need that we cannot provide? Face masks, water, soap, sanitizers, and protective clothing. That's all they need. And indeed, if you look at the number of frontline workers, doctors and nurses who have been infected in this period, it is exceedingly shocking and frightening. Shocking and frightening, you understand? Now, a number of things have happened that must be exceedingly worrying, for all of us. And one of the things which has happened, which should be exceedingly worrying for all of us, is the decision to open schools. What schools have we opened? We have opened day nurseries or crashes where 18-month-olds go to school. 18 months, not 2 years, 18-month-old babies. We said that 18-month-olds should go to school. First of all, those 18-month-old, What is it that they are learning which is so crucial that they must risk death in order to be able to learn? What are they learning? They are actually learning useless rhymes which alienate them from our society. These kids are going to the nurseries and learning to sing songs like London's Burning, Lukuyonda, Fire, fire, no water. Learning this rhyme is so important for Ghana that 18-month-olds should risk their lives in order to learn these useless rhymes which alienate the children from their culture and so on. It's unbelievable. Now, my colleagues have already spoken about some situations, and I just want to repeat them for emphasis. You have the Parliament of Ghana. Parliament of Ghana. And Dr. Apak is a member of the Parliament of Ghana. You have Osei Mensah Bonsu, member of that parliament. You have Haruna Igisu, member of that parliament. Many, many more names, Atachia and so on. They're all on that parliament. Some of them in parliament are actually ministers and deputy ministers. There are some people in parliament who have been entrusted with the management of parastatals. They are retired teachers and so on. Distinguished medical practitioners and so on. They're all in parliament. And we have come to the conclusion that these people, we can't trust them with COVID-19. We can't trust them. We cannot be sure that they will follow all the protocols. We cannot be sure. And because we cannot trust them with COVID-19, we cannot be sure that they will follow all the protocols. Let's close Parliament for 3 weeks. We have made that decision. So we have closed Parliament for 3 weeks. But we are saying that 18-month-olds can manage themselves better and follow protocols, so they should go to school. Jesus Christ of Nazareth. My goodness, that is how smart our leaders are. 18-month-olds can look after themselves. So let them go to school. But adults, responsible adults in parliament, you cannot trust them with the protocols and so on. So they should go home for 3 weeks. And then we are being told that the education of the children is so very crucial, so very important, that we should not disrupt it. Even at the risk of death, send them to school. Even at the risk of death, send them to school. And I'm listening, and I'm watching, and I'm seeing the very same people who justified the traffic light system of education saying these things. When it came to running a ship system which made children stay at home for 3 months and more and so on, they did not raise the issue of how important education is and why it is necessary to keep children, in school. It was convenient for them to argue that keeping children at home for 3 months is okay. But when it comes to fighting COVID-19, instruction for children in schools is so very important that push them to go and die. Can't believe this logic. I can't believe this double standards and so on. I can't believe it. But this is what we are faced with. I think it's important in discussing this issue of the reopening of schools and so on, to look at our current situation with regards to education. I mean, Dr. Kwesi Prat has spoken about the space available, space, and its impact on the control of COVID-19. And he has spoken about known cases of 80 pupils or students sitting in one classroom, which makes social distancing impossible. But that is an understatement. Because I've read reports of one school in which you have 120 pupils in one classroom. 120 pupils in one classroom. How do you maintain social distance in classrooms of this nature and so on? Unless our health and educational managers are not aware of this fact. And if they are not aware of this fact, why are they there? What are they managing? And so on. Now, we have said that we are relying on teachers and managers of educational institutions to provide guidance, to assist the children to observe the protocols and so on. Again, what are the figures available to us? What is our concrete reality? Our concrete reality is that if you go to some of the schools, you have one teacher to 100 or more pupils and students. How can they manage to provide appropriate guidance? One teacher to 100, sometimes more students. How can they provide appropriate guidance? It is simply impossible. You understand? Absolutely impossible. And we need to think, about what to do in order to avert this situation. Now, in the course of the week, one of the Anglican bishops actually made a passionate plea to government to close down the basic schools. Now, that passionate plea is instructive in many ways. For me, one of the ways in which it is instructive is that some of our leaders have been telling us that, God is in control. You understand? And as far as Ghana is concerned, Ghana is a God-loving country and so on. And God will protect us. And therefore we should pray and so on. First of all, these kinds of statements are most unfair to God. Most unfair to God. Because these kinds of statements portray God as a very biased God. God is not protecting Brazilians. They're dying in their hundreds of thousands. God is not protecting Americans who are dying in their hundreds of thousands and so on. But Ghana is special for God. So God will protect Ghana and will not protect Brazil and will not protect the United States of America. Why do you do this to your God? Why do you portray your God as a biased God? As a God who is not fair? As a God who discriminates against Brazilians? As a God who discriminates against Filipinos? As a God who is discriminating against citizens of the United States of America? Indeed, if I were God, I'd be very, very angry with these officials. Because these officials are very unfair to God. Exceedingly unfair to God. But you see, this statement by an Anglican bishop is instructive. It's instructive to the extent that the clergy itself realizes that the way to fight COVID-19 is not through prayer and fasting by concrete science, the application of concrete science and so on. You saw the footage on the funeral arrangements for our former head of state. You saw the footage, for our former head of state, His Excellency Flight Lieutenant Jerry John Rawlings. You saw it. I mean, for me, the most interesting part of that footage was when I saw another archbishop wearing double face masks. I'm sure that archbishop prayed in the morning before he went to the funeral and was likely to pray after the funeral. And yet, this archbishop found it prudent, found it sensible to wear double face masks. Double, not one, double, two face masks. So look, I fully agree. That we should allow science to lead us. We should allow science to lead us. That's the only way out of this quagmire and so on. Master, this is a serious matter. This is a matter we ought to be taking seriously. And I insist that we ought to be taking this seriously because of what is happening. I hold in my hand Daily Guide newspaper. The Daily Guide newspaper has a headline which is most instructive. This is the Daily Guide newspaper with a headline which simply says, COVID on a... Alright? Yes, certainly COVID is on a killing spree. In the initial stages, if you heard about somebody who had died from COVID and so on, you didn't know that person. Far away. You heard about people who had been infected by COVID, they were far away, you didn't know them and so on. Today, I don't think that there's any Ghanaian who doesn't know somebody who has died from COVID or has been infected by COVID. Master, it is either your husband, your wife, your girlfriend, your brother, your sister, your mother, your father, or your neighbor. That is how serious the situation has become. COVID, as Daily Guide says, is on a killing spree. That killing spree is so close to us. The killer is in our homes. The killer is in our workplaces. The killer is even in our hospitals and clinics and so on. The killer is everywhere. Now, somebody has said something which people like to quote. I'm not sure that I'm going to be able to quote it correctly. I'm told that this is attributed to Albert Einstein, who says that doing the same thing over and over and expecting different results is madness. It's crazy. We have done the same things over and over and over. The disease is spreading and spreading and spreading. Isn't it time for us to pause and to begin to think about other ways of doing things to avoid the label that Einstein places on those who do the same things over and over and expect different results? I think the time has come to halt, to ponder, to begin to ask important questions and so on. And indeed, one of the most important questions has already been asked by my colleagues. How did we get the British strand of the disease in Ghana, if indeed, in opening our airports, we took the correct steps, we took prudent management steps and so on, to prevent the importation of the disease? How come that we have the British strand? Now, yesterday, something very, choice of words, sometimes choice of words is a very difficult proposition. But yesterday, something happened. Yesterday, something happened which I've been reflecting on, and I'm not so sure how to describe it. The minister designate for information summoned so-called stakeholders to indeed what would amount to a jamboree, and told us how we are going to vaccinate 20 million people. I'm sure you all heard it. Master, as we speak, we don't have one vial of vaccine in Ghana. Not one. We don't have one vial of vaccine in Ghana. And yet, we are fantasizing about how we are going to vaccinate 20 million people, not 20 people, not 10,000 people, not 50,000 people, not 1 million people, 20 million people. And you don't have one vial in the country. What is this? Let us go back to the South African example. The South Africans actually found the resources, they placed the order, and they began receiving vaccines, only to realize that through the process of mutation of the virus, the vaccines they had imported could not provide security, protection for their people because of the capacity of the virus to mutate. They now found out that the virus they were dealing with was not the original virus which they found in Wuhan, or even the British variant. And therefore, importing the virus from the virus which had been discovered by Oxford University would not work. They had to change and so on. But yesterday, our minister designate for information was telling us that, the virus they will bring in the future, not the virus they have brought to.
Yeah, the vaccine.
Thank you, sir. The vaccine they will bring in the future, the vaccine they will bring in the future, not the vaccine they have brought already, is so good, its efficacy level is so high. How can he know? What is the science? A couple of weeks ago, we were dealing with the original virus. Now, we are dealing with the British variant. And given the capacity of the virus to mutate, I'm sure that in the next couple of weeks we'll not be talking about the British variant, but we'll be talking about a variant which has characteristics has distinguished Ghanaian characteristics.
This is the one mutating from the Doninga
variant. Anything is possible.
You understand? So where is the science which is leading us in the fight against COVID-19 and so on? Yesterday, I pulled out some figures. And they're interesting figures. I'm not going to use them today, But interesting figures which showed the impact of the spread of COVID-19 on housing, on public infrastructure, on transport, and so on and so forth. And it is frightening. Even these fake figures we are dealing with suggest that in some sectors of industry and social life and so on, the decline is as much as 48%. That's the decline. 48% and more, and so on. You understand? So if you do not take adequate, prudent, and scientific measures today, what will happen to us by December? What will happen to us by December, and so on? I am very, very deeply worried about the escalating situation. And I think it is important that we rise above petty party propaganda. I think it's absolutely important that we rise above pettiness and propaganda and to confront the reality of our situation. And in doing so, I think it is most prudent to follow the advice of the Ghana Medical Association. I think it is most prudent to follow the advice of the Ghana Nurses and Registered Nurses Association. I think it is our own collective interest to listen to the managers of educational institutions when it comes to reopening schools. I think it's in our collective interest to stop this hanky-panky Kokua Nancy games that we are playing with ourselves.
Thank you.